Right, it's 1 minute past 4 o'clock here. You're watching SABC News SA Today. All right, let's take it back then to Mthatha in the Eastern Cape. We are expecting the Health Minister, Dr. Zweli Mkhize, to take to the podium at any moment now to give us an address on the province and the COVID-19 stats there.
Those patients to quarantine. Those that are quarantined at home because they are not willing, we ensure that we monitor them at home. Now, our approach I'm trying to summarize MEC. I will not go by the slides because as you requested me. Okay. Now, let me just talk to the COVID deaths. Out of the number, the total confirmed COVID-19 deaths, the total number reported as at the 10th of June 2020 is 40 for OR Tambo district. That is the distribution. We have disaggregated the deaths per local municipality. And if you look at this, our epicenter, which is KSD, has reported the most deaths, which is 29, and followed by both Mhlonhlo and Nyandeni with 5 deaths each, and Port St. John's. We have also disaggregated our deaths by age, and we have, if you look at that picture, it tells us that it explains that 50 to 59 and 60 to 69 and 70 to 79 are the ages where we actually see our people dying. But we also do have some other categories, some age groups that are also dying. But we are also interested to know whether the people that die or cases that demise, they've got comorbidities. I won't go through all the slides, but it is very clear that amongst the 40 reported in OR Tambo, the non-communicable diseases like diabetes and hypertension, they are the most comorbidities that contribute to the death rate. These are the quarantine sites that we're using in OR Tambo. I won't go through to it. These sites, we are working with the Department of Public Works that identified these areas for us to quarantine all our negative patients once we monitor them for 14 days, as I've already spoken to that. So those are the sites, and those sites we ensure that they do meet the requirements in terms of the management of COVID. They comply. And this is the list. As we continue, we all quarantine our patients. But we also do have our planned beds for symptomatic PUIs, that is those that are still under investigation. And also we isolate our patients who have tested positive. That is the picture in terms of Nelson Mandela Academic. As MEC has already alluded to this, I'm not going to repeat it. But what is important is that the pinkish column, it is just talking to the beds that are available. We've got planned beds, we've got available beds. Available, it means it is functional, those beds we can admit. But the variance to the planned, it is when there is construction on site to ensure that that planned target is achieved. And the slide has actually explained at what stage or level of construction that particular hospital is. If you look at St. Elizabeth, for example, there's construction on site. We will have 30 beds for the pediatric unit that is currently being constructed. The Sir Henry Elliott, MEC has spoken to it, and Holy Cross is fully functional. And all these hospitals, we've got patients that we admit for quarantine and for isolation. St. Barnabas, there's also a contractor on site for additional 67 beds, which is almost complete, 99%, that we can isolate. We are going to isolate patients, Dr. Malizon Petle. So this is the whole list of the facilities that have got beds that are available for isolating our patients. And again, these are the facilities as outlined, Tanzibe, St. Lucy's, and Nessinite. We just want to quickly explain our approach to the management of the pandemic. I've reported that within the numbers that we've reported, which is 1,106 in OR Tambo, our KSD is our epicenter. And what we do, we disaggregate. We normally take a ward and we look at the number of active patients, the patients that have died and those that have recovered. With the active patients of 262, our approach is the ward-based approach, where we actually go to the ward and ensure that the team that is there is fixed to ensure that they identify all the cases that are positive and isolate and quarantine and trace and monitor daily if we want to control the pandemic. So this is the whole list of actually identifying all the various wards within KSD and the number of cases that are there. What we want to do, want to account for each and every patient. So if you look at the first slide, there are 23, 29, but we also have North Crest and other areas where we've got 5 cases each, 4 cases in the second one, 3 each. So all those, we are trying to ensure that the resources are directed according to the number of cases that we have so that we can be able to control the pandemic. I will skip this one, but we also want to report that we do have correctional services where we've just picked up, there's a cluster of cases that have tested positive, which is 25, and the correctional services, Wellington, so 15 were offenders, 10 were officials. And the number of officials in isolation is 8, 2 in isolation, and the 8, they opted for self-isolation. However, the team led by Dr. Ntanjana is ensuring that they visit them every day. And the unit that is Wellington has got an isolation beds of 19, and there are 54 inmates that we have already tested. And this is a team that is actually dedicated to follow up and this cluster at the correctional services. Now, I will not talk to all the slides that are talking to the cluster approach, but this is just the key one where we actually look at the ward. For example, Zimbabwe, and we then look at the population of that ward. And an integrated team, remember in a ward approach, you've got a leader that you should be working through. So the Councillor Mkhondo is the one that is the leader of that ward. And with all the other role players which are part of this ward, because each and every role player has got a key responsibility to ensure that we are able to contain the pandemic. So those are the people that are listed, your professionals, your health promoters, your CTWs, all the sectors of the department. Because our approach is to say, if, for example, we've got Zimbabwe, which has got 30 active cases now, if there's going to be SASA, we want to ensure that the job will take the services to this area so that we avoid movement. And we ensure that all the contacts and that are there have been traced, and all those that are positive are isolated. So this is the approach that we're going to use. We will identify positive cases, and those that require medical care, we refer them and at appropriate levels of care. For example, quarantine and isolation. So it will be tracking, tracing of contacts, we prepare them and we quarantine them. So that is the ward-based approach. The team that is working in these wards will be fixed. We are not going to move the teams from one ward to another ward. So this is just a slide that is talking to resources that are supporting the district. Myself, I'm here with the delegation from WHO, epidemiologists, and National Department of Health. We are supporting the district. We also do have a Cuban doctor that is currently at St. Barnabas, but the Cuban doctor will also be leading the tracing teams and also sits in the technical team within the district. And there are PNs that have been appointed as additional staff. There are about enrolled nurses 45, enrolled nursing assistants, and EPWP health promoters, because we need to empower communities about the preventative measures that they must do, like your basic washing of hands, mask, and social distancing. There are also social workers that have been added in the district. This is the support that we're also getting from our partners, supporting partners in terms of the human resources. This is TB HIV care, totaling to 82, and the Global Fund as well has also contributed support. Contact tracing, if I can just flag through this, we just want to report, I'll talk about overall as OR Tambo. The number of confirmed cases in OR Tambo and the percentage of the contacts that have been traced. The slide, it shows that we do trace contacts in the district. What we need to strengthen is the follow-up of the contacts 14 days after you've identified that they are negative. So that is the strategy going forward. Again, this is also a slide that is of importance, that the number of contacts taken smear and tested positive, the yield, where we are saying as a district, our yield is sitting at about as the 17%, but on average is 15.2%. So we are actually ensuring that we follow direct contacts. We are implemented the targeted testing. This is occupational health and safety. I won't go through the slide, but it is just outlining that we do have a district occupational health and safety committee, which is inclusive of organized labor. And also our hospitals, they also do have their OHS committees. This is the committee that conducts risk assessment, and actually the reports will inform, as per the guideline, the use of the PPE in the areas where there's high risk, moderate, and low risk. So we do have this. This is the PPE update. I won't go through it, but we know that we do have challenges with some of the items, like not necessarily challenges, except that some of the professionals would require to wear PPE, like for example in the garden they want to wear a coverall, which is not supposed to be worn in that. The healthcare workers who tested positive, we also want to report that there is an increase in the number of healthcare workers that are testing positive. And as outlined in the slide, this is a provincial picture, but if you look at OR Tambo, as at the 10th of June, there are 88 health professionals that have contracted COVID-19. But we also have done the vaccination for our healthcare workers. This is the provincial picture, but if you look at OR Tambo, these are the categories that have been given the flu vaccine. Your HIV and AIDS patients, healthcare workers, 65 years and above, chronic patients, they were given, and pregnant women. I won't go to the numbers. So I think the challenges, let me just quickly go to the challenges. I've already reported that we are seeing an increase in the number of cases in OR Tambo, with KSD and Nyandeni being our epicenter. And there are also delays in the turnaround time for COVID-19 results. We are working on that. We are having discussions with the laboratory, and inadequate availability of gloves, inadequate space for isolation of cases in health facilities, and increase in the number of health professionals contracting COVID-19. So our recommendations, as I've already spoken to, we quarantine, we isolate all confirmed positive cases, and we implement targeted testing in line with testing guidelines, and as well as we have since added 3 NHLS mobile testing teams, so as to ensure that all the contacts who are symptomatic are tested immediately. And we monitor PPE through stock visibility system, and there is continuous implementation of, we continuously empower our professionals on occupational health and safety guidelines to avoid this issue of confusion of when and where to use the PPE. And in preparation for our surge, we're going to build a 500-bed hospital and additional space in KSD, like airport hangar, which MEC has spoken to, and increase the tracer teams in KSD from 10 to 46. And this is related to the fact that KSD is our epicenter. And that is the end of the presentation. Thank you very much.
Thank you.
Thank you, Ms. Mokwe. I think Karazela, you have a fair idea of what is happening in the district. And that's what I'm telling And another issue that we have addressed here is the whole issue of working relations within our facilities. Acting was Mthatha General. Oh, thank you. I thought you were just going to tell us, because this is very important, whether your OHS committee is working. If you can stand so that you cover the lack of procedure. I will read was Nelson Mandela. The OHS Mthatha Regional. And you don't like you are going back on about unions, Papa. Let us mask and the oh, now, my you can't send me born. Diakona Dipiteki and his body too is social partners, as I say, because we spend a lot of time trying to put up the structure. Nelson Mandela, where are you with OHS?
I think the OHS can answer the question.
All of them. All of them are in quarantine.
But I can confirm, MC, that we have a working committee. We have actually called the Department of Labor to come and assess us because we are confident of the work that we've done. They have assessed us, they lifted the prohibition order, we've been given a green light to continue working. Thank you very much.
Thank you. Exactly the line I wanted was the lifting of the prohibition order. Because I thought I didn't want to report it, I wanted you to come. I know Untitled Stage also had a very steep instruction that everybody must wear N95 mask from the Department of Labor. But we're able to actually write back to them in mitigating that is not possible and it is not in the protocols that we follow, both World Health Organization and ours. Kabazela, I don't know as to how we would go from here looking at the time with our session rather than giving over to you. And I do want you to apply your shock absorbers. He has got a sharp eye, and I would want him to say right in our face where we have to strengthen our working. Because that's how we're going to win this battle. Want it? Oh, Shabiza, Kabazela, record.
You can move the mic, Peter. You can move the mic. Stand on the side here, so. Thank you. Thank you very much, MEC, Mayor, KSD, the MMCs from OR Tambo and all councillors present, Superintendent General, the CEOs of the various hospitals, public representatives, Inkosi, the professionals, thank you very much. Good afternoon to you. Thank you very much, MEC Gomba, for your kind invitation. We are visiting various provinces to have a look at various issues, challenges, and also look at the level of readiness just discuss and encourage everyone in this fight. I think that for me, it's been important to come here this time around. I've been watching that the MEC has been moving all over the province, visiting various hospitals and dealing with various issues, talking to the public, to the media. And that's important because the public has to be kept informed about what we're doing, and the public also must see us being able to address some of the issues that they raise. Up front has been the challenge of the tension between the labor movement and the Department of Health, in particular a number of hospitals that had protests and work stoppages, as well as where there were issues arising from Department of Labor requiring that the hospitals should cease operation. I'm very pleased to hear that now in a number of these areas there has been the activation of the occupational health and safety committees to be able to sit down and deal with the issues of the health, of the safety of our staff. Labor unions are partners in this work, and so we believe there should be standing forums wherein the occupational health and safety committees are established. We did announce a few, like 2 months ago, that we had set up this committee at national level. We agreed with the MECs that this will be cascaded at the provincial and district and local level, so that those who are involved in the work at a particular institutions or area, districts, should be able to discuss the issues of safety, particularly because at the forefront has been the concern of our staff about their safety, about their preparedness to deal with the issue of COVID-19 and the availability of protective clothing. And it is important for us that the protective clothing has to be provided so that our staff are able to go and address the issues of the raging infection with the confidence that they can deal with it, with the knowledge they have and the protection that they wear. That, for me, is an important issue, to find that there has been a meeting of the mind and the resolution of the challenges. And I really hope that these committees are going to be activated in every part of the province, so that rather than seeing work stoppages and confrontation, we are able to see everyone raising the issues and those issues getting resolved before there's any disturbance into the hospital and the care of the patients. It's important, therefore, that we hear that the Department of Labor has been engaged and that the approach is also standardized. We have said that training is important. Training to understand how to deal with the infection. It's a treacherous infection, simple to prevent, but can be devastating if we don't follow the simple infection control protocols. But we as health workers are trained and specifically armed to be able to deal with infections. Like soldiers going to war, we are always the ones who know exactly what needs to be done. And therefore it's important that we must do the basics, make sure everybody is well informed and well trained. At the same time, it's important to make sure that everyone is well protected, and also that it's important for everyone to understand the level of protection you need depending on the level of exposure that you experience. All of us have to take precautions. And certainly we cannot sacrifice our professionals whilst we're aiming to fight and defeat COVID-19. It's also important for each one to know what level of protection so that people do not demand the PPEs that are not suitable for the work they are doing. That each and every one of us has to be protected is important, but then there are different levels of protection for different levels of exposure. In addition, we have recommended that we must all wear masks when we leave our homes. And then such masks have to be the fabric masks, the cloth masks. And I've seen how creative people have been. They now start to make them to look very much fashionable. And somebody did this one and even decided I must put my name in case it looks like anybody else's. So you can do anything about them and put enough fashion on it, but just wear it. It's important that you have your own and you wear it. You don't swap these, you don't exchange them. And you don't leave it and forget it. The fact that you've got the mask doesn't mean that it can help you when you put it in your pocket or in your bag. It needs to be worn properly. And wearing it properly means it mustn't be hanging on your neck. It must not be hanging over your mouth, under your nose. And you've seen a few other people when they walk around and very confidently, when you say, but wear a mask, and say, here it is. And it's covering none of the parts of the body that they should be covering. So it's important then to say, we want to reserve the specialized mask for the health professionals who are at the level of caring for the sick, at the level of exposure, where the level of infection is higher, but that everyone else must wear the masks. Fabric masks are actually very suitable, but we can't actually start spending all the PPEs, giving to everybody when they go home into their taxis, coming back and they're wearing PPEs from the hospital. It's not going to help. That is why we've actually we distributed some of these to actually say to the health workers, you can wear this fabric mask on your way to and from work, as well as if you go doing shopping. But when you are at work, you have to actually wear those. It's also not correct that when you are in a highly infectious area, you wear a nice PPE mask, and then when it's time to go home, you walk home with it. You are actually carrying all the infection to your house. And so it needs to be very clear that we need to break the cycle of infection. So that is more about now saying that we would like to encourage a closer working relationship between the staff and the management, between the unions and the department, and make sure that everyone is upfront. If there's a problem on safety, we must deal with it. There's a problem with the shortage of the PPEs, we must deal with it. We are doing everything to bring to support in the supply of the PPEs. Twice now we've had to come to reinforce the MEC's office. In the last visit, before the President came, we dispatched a special aircraft to bring some stuff into the province. Last week, there was another whole truck that we also brought in and said to MEC, whilst the department is ordering, just go to a place where you see there's a shortage and make sure everybody has got. Just so that everybody can see that we're taking this issue very seriously. We will continue that work, and therefore I want to say thank you to all the stakeholders for being able to resolve the issues and work together. We're going to need each other. We're going to need each other for a long time to come. The fight against COVID-19 is a battle of partners. We have to work together as partners and fight a common fight. And therefore it's important for us to clear misunderstandings now and move on, because the future must find us strong and united, facing the really most formidable of the opponents that mankind has actually seen. An invisible enemy that is going to be devastating unless we're able to stand up and wage a very strong fight. We'll come to the Eastern Cape as well, under the situation where we've seen the numbers increasing. I think we must say to all of South Africa that the numbers of positive cases are going to increase. We don't like the rate at which it's increasing, but increase it will. I think we need to make that point very clear, that the numbers are going to continue to grow, but our intention, we have said it's not to actually stop the virus from spreading, but it's to reduce the rate at which it spreads. And this, for me, it's important now. We were in the Western Cape last week. We are here today in the Eastern Cape, and the real issue is that.
Sorry, I was trying to switch off this.
Oh, okay.
I'm sorry, Minister, the blue light is causing a camera issue.
That's fine. Let's sort it out. All right, that's fine.
They actually have to switch off the projector itself.
It's the projector.
It's the projector itself, yeah.
No, this is off now. It's the projector that needs to go off, yeah?
Yes, please. Thank you. Thank you very much.
Sorry about that. So the point which we want to make is that this is not the time to be complacent. Some people have got a wrong impression that when we say that we are easing the restrictions and the lockdown has been removed, that means now we can behave anyhow and do anything. Actually, COVID-19 is a much stronger infection now than what it was when we started introducing the lockdown. When we introduced the lockdown, we had 927 people who were infected and there was no death. It was after that we started seeing deaths. But we have seen the deaths now increasing to about 1,175, the last recorded, and we have gone over 55,000 and the numbers are a bit higher already now. That means we need to be aware that the numbers are increasing. And the only way to deal with this is for us to change our behavior. Basic issues, the use of masks, making sure that everybody, as you get out of your house, you wear a mask. And we say the cloth mask is quite adequate. And I think we need to just repeat that the cloth mask has to be worn properly. The cloth masks are better because you can wash it and reuse it, which is making it easier to use and more durable. Now those cloth masks, their biggest issue is that it is much stronger to protect the infection getting from someone who has it if they wore a mask. It helps if you also are wearing your own mask. But because some people can have the infection spread unknowingly, a mask for everyone is safe for everyone. But does it mean that wearing a mask is enough to solve the problem? There has to be a lot of hand sanitizers, using water and soap to clean our hands, and also cleaning up, disinfecting the areas which are commonly used surfaces. This idea which we are used to of touching everywhere and touching your face, we need to be now conscious of the fact that it increases the infection. Someone was even saying wearing a mask is even better because if you happen to contaminate your hand somewhere, at least instead of touching your face, you might end up touching your mask. So you must just know that the issue of wearing a mask is very, very serious. I want to leave that issue on the one side because the importance now of this team, this stakeholder forum that we have here, is that from national, we've got a command council which is consisting of the president and the national government. At a provincial level, a similar kind of structure led by the premier. At a local level, district level, a similar structure led by the mayor, wherein multiple stakeholders participate at that level. Why do we need these stakeholders? We need the stakeholders now because we want to take the battle outside the hospital. We want the battle to get out of the clinics. It must get out of the doctors' rooms. It must go into the community. People need to know that it is our people themselves who are going to fight and defeat this infection. It is our people who are going to help make sure that we reduce the spread by distancing. It is important then also to know that there are certain activities that have posed a huge risk of spreading the infection. The way we conduct our funerals is a big issue. We have now said we're easing off a lot of activities. The idea is not because we're saying COVID-19 is gone. The idea is because we're going to be with COVID-19 for a long time to come. It may be years, 2 years, it may be more than 2 years, it can be anything. No one knows because no one really can say that this virus has actually stopped spreading. Because of that, we have to now start adjusting to a new way of life. And the new way of life means we must make sure that everybody protects themselves and everybody protects the other person. And so these multiple stakeholders are about going out there to motivate communities to behave in a particular way. We have actually used the time which we got from the lockdown to expand some of our health services. You have seen some of the aspirations of the province. At least there is time now to create a bit more of the space. But I do want to say that we need to move and speed up a lot of those plans. The issues that we wanted to resolve with the lockdown was to make sure that we increase the staffing so that we have got more nurses now than we had before. At the time when we have to deal with COVID-19, there must be adequate nurses. There must be enough doctors and other health professionals. So we've actually been pleased to see that the province has taken advantage of that to move on. In fact, both the East and the Western Cape have shown us the numbers, and we have now sent a call to say all the nurses that are available must actually apply in the various provinces. And let's see where they'll get the opportunity. But we need them to come and serve. The same with the doctors. We have had a discussion with the Medical Association. We have asked them to tell us who is this doctor who's unemployed, so that we can actually start engaging them. We're not getting a large number, but nevertheless we're going out there to say, let's see who are those doctors, and then try and get them in. This morning we went via Butterworth at Goa, and one of the issues that we have said is of the problems that they are feeling in the area of staffing, various categories, nursing, management, and so on. We want them to start preparing how to solve that, because when we get back, on our way back to East London, we want to make sure that those issues are solved. I was quite serious when I was saying that we will be with the head of department, the superintendent general, and the MEC. So if all those documents are ready, we'll sign them up and make sure that the staffing issues get attended to as quickly as it can be done. So this is to basically say we're not going to be able to deal with COVID-19 unless we actually say it is business unusual. And this is the point that we have to put across. The numbers then in the Eastern Cape are rising, and I think that we need to really take great care of this, because whilst we know that the numbers are rising, we would like to see them moving slower up. Now, most of the provinces, up until the past 2-3 weeks, most of the provinces were actually basically generally stable in numbers, except Western Cape, which has actually shown a situation which is rather a fast increasing infection. That we have checked and looked at the fact that it's because of the cluster outbreaks. The risk now which we face is that when we start saying we're easing into more activities, there's going to be more cluster outbreaks in various parts of the country, and we've already seen the increasing numbers in the Eastern Cape is related to cluster outbreaks in shopping centers, in some of the factories, in funerals, and so on. When we look at some of those in the Gauteng and Northwestern Limpopo, that's being driven by a large number of miners who are coming from various parts of the country, including the Eastern Cape. So we have said there must be, protocol that requires screening before people get back into workplace. It's much safer to delay your start at work, ensuring that everyone has been screened so we know that they've got symptoms or not, so that they can be referred to testing if necessary. And we say those who have got those symptoms should rather stay at home and not come to work. Because you are better off if one person is absent than if one person is at work, has got symptoms and infection and infects others, because we're going to be forced to close down that operation. So those issues are now the reality of how we're going to be running our services. So we've been looking at the numbers. OR Tambo, 3 weeks ago, we said we're putting it on the watching list. The numbers are increasing now. We've seen the numbers are increasing, and we're now looking at it as a hotspot, and therefore we need you to move further. On your report that you have given us, I've seen that there's quite an effort to try and break the areas down. In reality, we would like to see the district being firmly divided in terms of sub-districts, easy to do, which you are when you are having various municipalities, where you have to focus on how to deal with that particular area as a sub-district. It's the way we're going to be doing it, and you will have seen that we have done that now in the Western Cape. We're going to be doing that in all the hotspots, and that's the major shift in our intensive intervention on dealing with COVID-19. A point that has been emphasized, and I like the fact that you've now got someone, Chief Director from the head office, deployed to the district. Now we call that flattening the structure. This bureaucracy is creating a lot of delays. You see, in the same line, in the same vein, the President has said ministers must go and be assigned to the districts, which means everyone whose leadership must be where the action is. They must get to see what the challenges are, help us to support those who are in the forefront, and they must also make sure that we shorten the distance. Because if the minister is there, then the minister knows that there is a minister who I must call, who must help us solve this. There's a cabinet that I must report to, and so on. So we've welcomed the decision by the President, and I think all of us are waiting to see ministers, deputy ministers, DGs, and chief directors from head office coming to the districts. They have to, because you need the support. And up to now, you've actually done a great job fighting this infection, and everyone has been doing a great job even at national level, but I think the closer we are together, the more helpful it's going to be. So we are then saying, Eastern Cape, we are concerned that these numbers are going to be moving so fast that you've seen a few times that numbers in West Eastern Cape have been higher than Gauteng. Not that Gauteng has to have higher numbers, but there's a bigger population there. Now the issue therefore is, the point that was raised here by the Chief Director of identifying and isolation is the key that we must never lose. All the people who are found to be positive, that's why we're saying in every sub-district, let's find them and send them to quarantine or isolate them. It's going to be important that we do that because we have to break the cycle of infection. There is no shortcut. That's the way we need to go. We need to make sure that all of those people are dealt with in such a way that they are put comfortably in isolation or in quarantine so that no one continues to spread the infection. We don't want another province to get out of control where you end up with numbers where infection rate is in such a way that one person's got the infection can't even account for where who the contact was that had actually spread the infection. That by that time it means really we're dealing with a real bushfire. That is something we still have to fight, but I'm saying you need to move further ahead. You still got an opportunity to move further ahead of the curve, and I think you must maintain your speed. Pick up your speed so that you can maintain that position. That is a key issue for me as we're discussing this issue in the Eastern Cape. So it means, therefore, that everyone has to be a bit more organized at the level at which your issues need to be attended to. You need quick responses from top leadership. You also need everyone to cooperate so that we are able to deal with these particular issues. So from the point of view of dealing with the report, I am quite comfortable that you are all on the right track. You are on the right track, but we need more speed now. We need speed, we need unity, we need focus. When I say speed, I'd like to make sure that at any one time, if there's someone who's positive, we know where they are. Right now, you still had a gap between the contacts identified and the contacts that have been reached. That gap, Eastern Cape is still the biggest. Unless you close that gap, you're going to suddenly find that there will be people who will be contacts and get infected and be positive, spread the infection even before we discover them. Then they will be out of the infection, and the infection will be raging in areas where we've got no clue it's going on. That's the point which I'd like to make to you. Let's move it, because we need to do so. We need to then reach out to the traditional leaders and make sure that we talk to our communities, local leaders. We need to make sure we deal with the issue of stigma. There is no reason for people to fear to expose their symptoms. They must disclose their symptoms. They must also disclose if they are tested positive. We will assist, and we also want to make sure that they can be taken care of. Those who are positive need to be supported. There are challenges out there. I've heard the concerns about people going out. I think that some of the problems arises from one town with a lot of rural villages, small town, Lusigisigi, with the thousands of people who come all at the same time for Nkam. It becomes a big problem to manage that because all the shops are in one place. I think this is also one reason why we need to actually use the COVID-19 to start reorganizing our economy. Because if everyone is going to come from all the villages into one small town, and then there's one big retail shop, everybody must queue in there. And then they must also take a taxi and go back home in the afternoon. You are bound to actually get this overcrowding. So these are some of the challenges that the COVID-19 has actually exposed our weaknesses in the way we do our work, in the way we live, and the way we are organized. So those are some of the things that we have to work together to still help people to keep a distance, even though there's a problem that there's only one shop that serves them. We need to actually help our people at that level. We need to also focus on the elderly. The senior citizens need to be protected. And in the process, it's also important to say there are many of those who have got comorbidities who must also be assisted at the same time. The large majority of the people who pass have got other underlying conditions. Some of them 1, some of them 2, some of them 3. It therefore is important for us to know that senior citizens, people with comorbidities, do need to be assisted. Now, if we get these teams into the sub-districts, they will actually be assisting us to deal with the community health workers who must go all out and help them to be able to get their medication at home. And in that process, make sure that we continue to offer the rest of the health services so that it must never appear as though now there's no more diabetes, there's no more TB, there's no HIV, now that there's COVID-19. COVID-19 is a new entrant into this big, sea of ill health that we've been dealing with. And out of that, we need to make sure that we don't leave those who have been having the infection. There are other problems behind. So we have to actually activate our health services to work better. That's why we have to try and cover as much as possible of our shortages, so that these, once corrected, they'll help us as we move into the future onto the NHI. So that for me, MEC was about to say to the team here, we can see that the clouds are gathering and we need to move pretty fast. We'll give you all the support that we need to give you. Let's therefore make sure that we move ahead to prepare for a situation where the numbers are higher, and that is part of our responsibility that we have to face in ensuring that we provide our people with better health. Let me see if we are able to give you any of the latest figures. I think at this point, we just will issue for you a probably more detailed statement. There has been a point here which was raised by the Chief Director about the challenges of tests. Yes, there are challenges with tests, but we must not underestimate the fact that we've done a lot of tests. I have said to our teams that at the end of it, the management of a positive patient and the contact is a clinical decision. So if someone has got symptoms, the fact that there's a delay in the test shouldn't undermine the treatment that the patient will have. That means that those symptoms will guide the doctor to know whether the patient needs to be admitted or not. But in addition, we have said that we are prioritizing those who are patients under investigation and those who are having symptoms and those who need to get particular treatment structured on the basis of the positive test and so on. That at the level as well as staff, because of the fact that the health workers, we need to know whether you have to stay on, you have to move out of your post. So we will prioritize those. But we're nevertheless going all the way out to increase the tests that have to be done. The fact that we're focused on the backlogs doesn't undermine the fact that today we've reached the landmark of 1 million tests that have been done in the whole country, both in public and private. That doesn't mean that's enough. It just means that when we have challenges, we must not undermine the fact that we've done a lot of that. And at this point, I do want to pay tribute to the laboratory staff, both in the public laboratories and the private laboratories. In particular, I also have to pay tribute to the nurses, the doctors, and all the professionals who look after the patients, who have to be the first person who has to take the risk of saying, I'm going to look at this patient in the eye and say, I suspect you have this infection, let me do a test. Sometimes do so and only find that it was the first, and if that person would have missed it, then would have actually got the patient missed. So I do want to pay tribute for the work that they have done. And in addition, I do want to also say that there have been increases in the numbers of people who are positive, and you will notice that in some of the instances, some provinces now, like the Western Cape, are increasing by over 1,000 and something, and now we've got others who are increasing in larger numbers. So the total number that is reported today is 58,568. That number is indicating the change from last night, from the number that we presented last night. Now, it's going to be a bit tricky for me to give you all the provincial numbers. Oh, thank you. Yeah, I think this helps. Thank you very much. Now, so Eastern Cape has gone up to 7,868. We need to account for each and every one of those patients. Are they isolated? What about the contacts? Are they quarantined? If we can't account for all of those numbers are going to go wild. So that is the message to you. Free State, 406. And I want to make a point here and pause here because this was the first instance where we were able to show a slowdown of what was promising to be a raging infection with a huge amount of focus, rounding up the whole place. We were able to slow those numbers down. Of course, they've gone up to 406, but this was the fourth highest growth point in the country. Right now, it's gone down quite a bit. Gauteng 7,953, KwaZulu-Natal 3,472, Limpopo 267, Mpumalanga 228, Northwest 757, and all of us recall that Northwest had a very small number recently, but we then eased off and said all the miners must come back, and this is what has happened. So the screening is happening, and out of the screening they are finding a lot of people out, as it were. It's good, the fact that a lot of screening gets to be done, and therefore we are keeping track of these numbers. We've got good cooperation from the mines, we've got good cooperation from the Minister of Minerals and Energy. We work as a strong team just to keep an eye in this part of the industries. Northern Cape 132, Western Cape is at 37,422. We still got a small number that is not well allocated, about 63. So it is therefore important for us to indicate that that is what we are looking at this point. We will much later indicate the numbers of those who would have passed, because that takes a while to reconcile those, and so we will move on from that point and make those numbers available. We will continue to share this information in public, but we're also moving towards, maybe not immediately, but we're moving towards a point where there's going to be an easier access to an electronic system or a digital system where it is easy to find all of this information. But it is, for me, quite interesting to say we have also started implementing a tracking and tracing platform, which we will announce in the next day or two, which has also been started in the Western Cape. This is a national platform that would like to make sure that Eastern Cape takes advantage of it. Now, I haven't had the chance to talk to Dr. Mkhize, but let me say, Dr. Mkhize, when we launch this next week, we would like to make sure that it's fully implemented in the Eastern Cape. So we will give you all the details so that we use it now to catch up with the tracking and tracing of the individual using an electronic platform or a digital platform. And that platform must help us to be able to reach out to some of the people that might take a while for us to reach. We have to move with speed to try and contain the numbers, but having said so, I'm saying you're on the right track, but you need to pick up the speed. Thank you very much.
Well, it's never the best news that we would want to hear, but again, it's the best news that we want to be told so that we know what to do. Thank you very much, Kawazela. We knew, us inviting you, you were going to be able to give us something to chew on and some way of doing things. But what you did today, which is quite interesting, was strengthening the confidence of our teams in ensuring that as we now move for targeted testing, we're on the right track. And we're now wanting to master that in all the districts. You may be calling it ward-based, you may be calling it sub-district, you may be calling it a cluster, but at the end of the day, it comes down to one thing, that you are now getting to the minutest structure in the communities to ensure that you are cutting the virus. And
all right, so that's that briefing there from the Nelson Mandela Academic Hospital in Mthatha in the Eastern Cape. Just some important information for you coming out of that briefing. 88 health workers have tested positive. The health department is trying to trace all contacts and isolate. There's not enough gloves for health workers there in the Eastern Cape. 500-bed hospital is being built in the Dalindyebo district, so those are some of the issues, some of the points that were raised there. Minister Zweli Mkhize talking about change of habits required to stop the numbers from increasing. The increasing numbers are related to cluster outbreaks from group activities. Hence, the government has been trying to stop us from having these group activities. So that is the main reason, the contributing factor then to the increasing numbers of COVID-19 positive tests. And then today marking the landmark of 1 million tests having been conducted, as said there by the Minister of Health. We're going to take a short break. Do stay with us here on SA Today.